Joining us now is Mr. Alden Parker, Sacramento Regional Managing Partner of the Fisher and Phillips law firm. Fisher and Phillips is a national law firm representing employers in all aspects of labor and employment. Alden is also the co-chair of the Fisher and Phillips Hospitality Industry Group and member of the COVID-19 task force, which means he's busy. Today, he's going to talk to us about a grand reopening, litigation risks for hospitality employers due to COVID-19. Take it away, Alden.
Great, thank you very much, and I appreciate being with everybody today. So today we're going to talk about reopening, trying to get past the period of time where these shutdowns have really hampered operations in the hospitality industry. And on the next slide, I'm going to take you through sort of a continuum of what we're looking at in terms of starting with the relief that we've received, moving into a period of time where we've restarted, probably a very lengthy period of time where many in our industry are going to have to recover from this, and the economy is going to start to recover as people start to move around. And today we're primarily going to focus on this last bubble that I put up here, the risk bubble. We're going to talk about where we see these things happening, what types of issues we see coming up. And on the next slide that we'll go to, we'll take a look at each of those individual thoughts that we're talking about. Now, today is a very quick, sort of punchy approach in looking at these issues. During the deeper dive, we're going to get into each one of these specific areas. But the litigation risks that we see that are coming up when we're talking about reopening hotels and restaurants, different retail establishments, certainly have to do with face coverings, employee temperature checks, customer health screens, sanitation, a lot of wage and hour issues, and a lot of FFCRA retaliation claims that we're starting to see bubble up. We have a litigation tracker on our website that uses artificial intelligence to pull all of the new lawsuits that are being filed that go ahead and show COVID-19 as a subject in them. And in those instances, we're following and tracking those numbers by state so that you can go to the website and track yourself, see how your state's doing in that regard. See, obviously, I don't know if we want to call it leaders, but certainly the states with the most litigation already in these various issues are two that you would suspect: California and Florida. New Jersey doesn't immediately come to mind, but it also has a number of these claims that are coming up. So when we talk about this area, if we can go to the next slide, we'll see the emerging litigation trend that we see, where we're starting to show a particular trend in this litigation having to do with employees that had pre-existing health conditions we may have already known about as a result of FMLA leave or some sort of state equivalent. Other places where individuals have had some sort of disability accommodation or were in the midst of considering disability accommodation, and all of a sudden there's this overlay with concerns about reporting to work because of COVID-19 or concerns about infection and those individuals. We really need to emphasize creating a system that is pretty flexible in this area, addresses how we're going to respond to employees that are requesting time off for a COVID-19 related issue or accommodations that may have to be made, while a lot of these litigation issues that are specific about COVID-19 get worked out. One of the dangers or difficulties in dealing with this emergency trend is that we don't know from a litigation context how these things are going to work out in the end, what juries are going to do with them, what judges are going to do with them. All of these things are being fit into traditional frameworks of the Americans with Disability Act or Family and Medical Leave Act. A lot of the issues are being repackaged in those more traditional areas, and it's very difficult to see how and what type of flexibility judges and juries are going to give to employers faced with these issues. So we're looking for, and sometimes this can be very maddening for employers, but we're looking for a great deal of flexibility being given to the employees dealing with these time off requests, been dealing with COVID-19 issues that they may be faced with in order to avoid what could be a real explosive litigation trend happening. So far, I think it's fair to say there certainly is a litigation trend that has occurred, but it's not the absolute avalanche that a lot of us may have thought was coming down the pike. It's something to be cognizant of, but it doesn't seem to be the overwhelming issue that everybody faced. Now, the problem here is it has a long statute of limitations for a lot of claims that come up as a result of COVID-19 or may have been triggered as a result of that. We also have a lot of federal relief getting in the pockets of employees that have, I think, tampered down the number of lawsuits that we've seen in this litigation trend. So as the federal benefits and the state benefits start to dry up and the economy settles into a period of time where we're going to have increased unemployment in certain sectors that remain relatively high compared to the way it was before COVID-19, we really could see some increased litigation pressure come on within the statute of limitations, but during the period of time as the benefits and the assistance starts to wane. We are still watching and seeing how that trend is going to occur. So if we could go to the next slide, we're going to talk about one of the areas where this has come up. In the area of masking, certainly it's a very hot political issue for a lot of people, discussion point for a lot of people, having to do with putting on a mask, wearing a mask, whether it's customers or employees. And there have been lawsuits that have gone ahead and spurned as a result of what the employer has gone ahead and created in their workplace. I'll talk a little bit more in depth about this case during the deeper dive, but even in Texas, there's been litigation involving a restaurant that was prohibiting an employee from wearing a face covering at work, citing that it was the customer's expectation that they'd be able to see the employee's face and either smile, or maybe they were upset that day and frowning at someone. Despite federal recommendations that masks be worn and local orders that said covering should be worn, this establishment was taking a different tact, and an employee sued over that issue. Tune in for the deeper dive. I'll talk about what the result of that is so far in the litigation, but it is meant to highlight that even in employer-friendly venues like Texas, these issues are really coming up about employers' encouragement of employees wearing masks or adhering to customers going ahead and wearing masks in the facility. If we could go to the next slide here. So temperature checks are another area where litigation is coming up. Some jurisdictions are requiring temperature checks. Some don't require temperature checks of employees before starting work. But it certainly is a potential area where we're thinking there may be wage and hour litigation that comes as a result of this. It's surprising to sort of shift from talking about temperature checks to wage and hour litigation. But those of us that have looked at this issue really do think that if a temperature check program, a policy that an employer comes up with or a practice that an employer comes up with to meet some sort of local temperature check regulation, where is the liability that comes out of that? And we think it's in the area of wage and hour litigation. Now, at a federal level, we have the FLSA and how that would apply. And principally what we're looking at is the time before someone clocks in where a temperature check is taken, is that something that has to be compensable? And I'll talk a little bit about what the FLSA holds in that regard, where we think that might go, and anticipating on whether or not a temperature check is, and here's the magic phrase, a principal activity that the employee is engaged in. We've got to go ahead and analyze that from a federal standpoint. But I also want to bring to everyone's attention that a lot of states look at this very differently in a very much more strict way. So if you're in, for instance, New Mexico or California, we're looking at a very strict interpretation of what it means to be subject to the control of the employer. There's been recent litigation involving post-shift security checks at Apple, where they were found to be compensable, even though there were very small amounts of time. And so we believe at this point that in certain state jurisdictions, that have a stricter interpretation than FLSA, the prudent employer is going to be looking at temperature check time as being compensable time and working that into their process somehow, whether it's adding time, an automatic amount of time to a payroll or a POS system for clocking in and out at the end of the day or the beginning of the day. That's a system some people are going ahead and doing. It's a very difficult area. It's something we'll talk a little bit more in depth about later on in the program during our deeper dive discussion. But if we can get on to the next section here, that'd be great. So one of the other areas that everybody is looking at having a lot of increase issues about is this workplace safety issues. These OSHA guidelines, we're seeing a lot more OSHA compliance letters having to do with going ahead and maintaining social distancing, having plans, having masks, dealing with outbreaks, and how different counties or jurisdictions go ahead and define that. Many states and counties and cities are all defining what an outbreak is that requires reporting to various local health officials. And we need to be cognizant of that requirement in your very finite site-specific rules. So if you have a hotel or if you have a restaurant in a specific county, it is not enough to simply look at what that state does. You should be looking at your county ordinance or even down to the city level in order to see if they define an outbreak from a workplace safety situation. A lot of places are defining a workplace outbreak as 3 or more positive tests within a 2-week period, and that's requiring reporting directly to the local public health official and having them work with you on a monitoring program, getting those employees back to work or approving their return to work. There's a lot of sort of minute details that they're imposing upon us at a very, very local level that we need to be able to watch out for. In the workers' comp arena, we're certainly seeing a trend of claims that are made where COVID was contracted at work. Different states and different jurisdictions are dealing with this differently, from executive orders which presume that if someone got COVID-19, it happened at the workplace if they were working somewhere where they're not working remotely. Others have gone ahead and left the traditional burden of proof framework where an employee can go ahead and try to prove that they got it at work by saying, for instance, they don't go anywhere, they stay at home outside of work, and no one at home has gone ahead and contracted COVID-19. They all stay at home at work, and so they must have contracted it at the workplace. Failure to follow local guidelines, local ordinances, regardless of whether ultimately they're determined to be laws or not. If we're failing to follow the CDC guidance, the OSHA compliance, the city ordinances, the state guidelines, it will make us susceptible in the workers' comp system to claims that we're either ignoring safety procedures. In some states, that can lead to penalty impositions. For instance, where I am in California, we're seeing a lot more serious and willful claims where someone claims that they're entitled to a 50% penalty increase as a result of an employer ignoring certain workplace safety guides having to do with COVID-19 and someone contracted it. It's a very real trend that we're seeing and something that people have to maintain. That's the reason why we're focusing on all these minute details, is to avoid those types of penalties being assessed in the workers' comp system. Let's go to the next slide. So there's always a question about customer health screening. We certainly have not seen this be a very widespread phenomenon. And we have not seen a big trend of lawsuits by customers, thankfully, where they're claiming that because of someone violating a local ordinance or a state ordinance or failing to follow OSHA or CDC that they contracted the illness. But some have looked at this issue of liability waivers and whether an assumption of the risk agreement or a liability waiver by an employer or by a customer is a good idea. Certainly the business folks may have something to say about this and whether you write a big scary liability waiver that a customer is going to sign, that may not be the best business strategy as you're building back your customer base. But some certainly are looking at this issue and thinking about whether or not they come up with some sort of liability waiver when someone is coming to a hotel or coming to a restaurant and they're thinking about the things that they can have someone agree to as they sign. At first, with most of us opine that these weren't going to be worth anything. That line of thinking has really changed a little bit in terms of thinking that liability waivers or assumption of the risk agreements could be applicable in a customer setting, likely are not applicable in an employee setting. Having an employee waive this potential liability for coming back to work. There are lots of states that specifically disallow that type of agreement. But customers certainly are free to come and go. And so if they elect to stay at our place or visit our establishment, we think that we can go ahead and have some level of liability waiver or assumption of the risk agreement. We just haven't seen the trend yet materialize. Let's go to the next slide. So one of the areas where we are seeing actual cases get filed so far is denial of the Emergency Paid Sick Leave or Emergency Family and Medical Leave Act under the FFCRA. We do see cases involving airlines where people are claiming that they were retaliated against for requesting this leave. I'll discuss the specific case during our deeper dive. And it's an important case. It talks about and really is an example of the type of paper trail that will be left in people's request for time off as a result of a COVID covered leave under the FFCRA, and steps that an employer may have all of a sudden gone ahead and taken against someone for exercising that right to a paid leave at this point. As schools are starting, we're anticipating more and more under the Emergency Family Medical Leave Act, where people are requesting or going to request a certain accommodation of schedule or certain time off because of a need to care for minor children that are still in school. The FFCRA even has Emergency Family Medical Leave Act all the way up to 18. So you could have a driver that could certainly get themselves in and around or certainly control their school schedule. If you asked me to help my son with his AP coursework, I couldn't help him with anything. But the Emergency Family Medical Leave Act seems to still suggest that if need be, I could be home and getting paid for that time, going ahead and making sure that he's going through the system correctly. So careful issue. I'll do a deeper dive on this one when you tune in for the full program. Let's go to the next one. We certainly see that during this time of recovery, we think there's going to be a lot of focus on the wage and hour cases. We see the advertisement on the plaintiff's attorneys' websites where they are talking about if you feel that if your employer has treated you unfairly because of COVID-19, call us. And they will call them. But then the letter that we're getting is about traditional state and federal wage and hour issues. So whether that's bonuses, pay adjustments, meal and rest, exempt status off the clock, the whole gambit of issues are showing up every time that someone has what I call a COVID-19 interaction, a negative interaction with their employer. All of a sudden we're getting letters about additional wage and hour issues. And the subtext or the marketing platform that the plaintiff's attorneys are using are COVID-19, but they don't know how to evaluate them. I've talked with plaintiff's attorneys that I know. They don't know how to evaluate the COVID-19 cases on their own. And so what they're really looking at is, can I find someone, turn it into a traditional state wage and hour case that I know about, I know how to value that, and come after the employer that way. We are seeing that. I'll talk about the specific cases during the deeper dive, and let's get to the next slide here. So I came up with and went ahead and talked about what these 4 pillars look like: the relief, the restart, the recover, the risk. But I will tell you that it looks a little bit differently. Not all of these shapes should be equal in size. As I said, that recover should probably be a stretched rectangle where we think the recovery period is going to be much longer. But if we go to the next slide, when we talk about the cases and we talk about what we see, I think we will see that this is probably a more accurate depiction here up on the screen, where the risk is quite large. All of these different issues, from the local orders to the masking to the temperature checks to the FFCRA, they all bring their own potential risk associated with them that employers are currently facing. We think employers may continue to face as the federal money and the relief goes ahead and dries up, and as the economy still starts to struggle in our industry. Let's go to the next slide here. So that's the end of my shorter presentation, and we'll go ahead and do that deeper dive. We'll have time for questions there, but that's it for now. Stephen?
Alden, thank you very much. Terrific information. And everybody, encourage you to spend some time with Alden on that deeper dive in October. It's going to be fantastic. Alden, can't thank you enough. A lot of time and energy went into this presentation. Appreciate it greatly. Great thoughts. We'll look forward to your deeper dive.
Thank you.
Have a great day.